ground. Melanoma is a mole-like malignant tumor, also known as melocarcinoma, that multiplies cells rapidly anywhere on the integumentary system and damages skin cells. Here we see a melanoma tumor that is smaller than 1/4 of an inch and one that is larger than 1/4 of an inch. The larger one has started to become melano, meaning that it has started to expose a black pigment to its appearance. The history of melanoma goes back about 2,400 years ago. Melanoma was first founded in mummies. In 1787, John Hunter had become the first surgeon to perform surgery on melanoma, and in 1956, Henry Oliver Lancaster discovered that sunlight can play a big factor to its causation. Melanoma can occur anywhere in the skin. For men, it occurs most often in the back and the chest. For females, it occurs most often in her legs. And for both females and males, it occurs most often in the neck and in the face. The signs of melanoma consist of a growing mole on the skin, which then becomes unusually looking, turning into a non-uniform mole, having either an odd shape or uncertain border. It can also become a chorloma tumor, meaning it is becoming green in color. The symptoms of melanoma consist of an itchy sensation, bleeding, or pain. In 2014, there were about 76,100 cases of melanoma in the United States. Of those 76,100 cases, 9,170 resulted in a death. People who live in places that are more exposed to sunlight and people who tan more often are more prone to it and are the ones most affected by melanoma. Here we see a chart of both males and females in different age groups affected by melanoma in the years of 1988 through 2009.
The causes of melanoma consist of spending a lot of time in the sunlight, use of tanning beds or sun lamps, bad sunburn, organ transplant, and X-ray treatments.
An earlier diagnosis of melanoma equals longer lifespan, and a later diagnosis of melanoma equals a shorter lifespan.
Here we see a chart of the survival rates of melanoma varying from stages 1 through 5.
Ways to prevent melanoma are to limit exposure to UV light, limit exposure to sunlight, and the use of sunscreen. A diagnosis test for melanoma can sometimes be detected by looking at the skin, a biopsy, or an analysis by a pathologist by the removal of the mole. Treatment of melanoma can be surgical removal of the melanoma mole, also known as resection, Mons micrographic surgery, radiation therapy after resection, SRS stereotactic radiosurgery, usually used when spread to the brain.
Here we see a picture of a stereotactic radiosurgery treatment. And here is a picture of dissection.
The side effects of treatment to melanoma is a small scar due to resection, a loss of hair, sunburn like skin problems, fatigue, nausea, loss of weight, and appetite. The economic cost for melanoma treatment between the years of 1990 and 2013, with Medicare, average annual cost was $44.9 million to all ages and cases, and without Medicare or Medicare insurance, average annual cost is $932.5 million to all ages and cases.